presentation on cosmetic surgery. We will have Dr. Athanasios Christopoulos anaphylaxis. This is an example of a small flexible clinic where throughout the entire course of the patient, we have the same physician attending to the patient, following up, because a large share of medical tourism is developed by small clinics and not by major hospitals. So anaphylaxis, which is an example of a clinic that has provided excellent services to international patients, is going to share with us their experience vis-a-vis the trends in the area of cosmetic surgery for Greece. Mr. Christopoulos, you have the floor.
Thank you. First of all, I would like to thank the organizing committee, Mr. Toudas, Mrs. Georga, for allowing me to present this topic, and I want to thank all the participants for their patience to listen of me. Just to present me, I'm a plastic surgeon based in Greece, in Athens. We have, as Mrs. Georgas told, since many years anaphylaxis, but now recently we created a new clinic named Dr. C Clinic in Athens, and in the same time I'm medical director and I work in Dubai as well in advanced aesthetica. So I work in two places with medical tourists in the same time in both places, and I'm based on my experience on both these places. So as an introduction, I want to tell you that identifying and understanding the target markets helps improving our marketing strategies, helps to better patient engagement, and helps to increase business success as well. It is needed for clinics to tailor their services and marketing efforts to specific target markets to meet their unique needs and preferences. So first of all, we have to target our clients, the markets. We cannot be addressed to any market, to any client. So it's important to target markets which present a high request for cosmetic procedures, and vice versa. Is important to adapt our services to these markets to meet the unique needs and profile of them. So, which is the ideal target market? If you expect me to tell you the magic names, I will tell you that I cannot do it, because as usually in these questions, the reply is it depends on different factors. So when we make a question, which market to target, it's a reply which is different for each clinic. And we can say that even clinics from the same city, nearby one to the other, offering the same services, may have completely different target markets. So first of all, in order to target our market, we have to identify our profile. What is the profile of our clinic? The clients, what is the target group of our clinic, first of all? What type of procedures we offer, what is the economic profile of the existing clients that we target, that we have got used to target in our clinic, what is the location of our clinic, and what is the language or the languages spoken in our clinic. So after this, we can identify the profile of the clients that we want to target. So first of all, we have to type the procedures to offer. We have to see what economic profile we want the targeted clients to have. What are the countries of interest? What is the location of our clinic in relation to the countries of interest, and then the languages spoken in these countries. So let's see some additional factors to consider when we identify the target markets. One is the demographics, which means age, gender, income, and lifestyle. Then is the psychographics, which means understanding the psychological and social characteristics of the potential patients, including their motivations, their desires, and attitudes towards cosmetic surgery. And then is the geographic location, like different geographical factors, such as location and cultural norms. Let's give some examples, for example, of target markets, target group of peoples, I would say. For example, we can, are the millennials or Generation Z, this target group has a growing interest in cosmetic procedures among younger generations, including the desire for non-surgical treatments, and the other characteristic is the social media influence. Then we have baby boomers and Generation X, which has an increasing demand for anti-aging procedures among the older age groups. This includes facelifts, dermal fillers, and body contouring as well. Another group is the high-income individuals. This is a potential target market of affluent individuals who have financial means to afford cosmetic surgery procedures. And then we have medical tourists, which is a growing trend for cosmetic surgery, and it includes potential target markets from countries where cosmetic surgery is less accessible or less affordable. And another group of patients is the post-bariatric surgery patients, who are patients who have undergone significant weight loss and may be interested in body contouring. This is because the bariatric operations have grown in numbers significantly during the last years. So, one of the primary factors to consider is the demand for cosmetic surgery in a particular country. Then we have to do a research of popularity and acceptance of cosmetic surgery in different countries to identify the countries with a higher demand for these procedures. We have to look for countries where cosmetic surgery is culturally accepted and there is a significant market demand for it. And so this can be determined by factors such as the prevalence of beauty ideals, cultural attitudes towards plastic surgery, and the media portrayal for cosmetic procedures. So a very important factor for to target foreign markets is the healthcare infrastructure, which is very appealing to patients. Countries with advanced healthcare facilities, with modern infrastructure, with a robust healthcare system, a very trustful healthcare system, availability for skilled plastic surgeons, and state-of-the-art medical equipment, and giving post-operative care are very appealing to foreign patients. Another factor is the affordability. The clinics should analyze the cost of cosmetic surgery in different countries and compare it to the financial capabilities of the targeted market. So countries with competitive pricing, with lower cost of living, favorable exchange rates can be attractive to patients seeking cost-effective options for cosmetic surgery. However, it is essential to balance affordability with quality, because the clients want are interested about quality as well, and safety, in order to ensure the optimal patient outcomes. Some cultural considerations. Understanding the cultural norms and preferences of the target market is crucial. Patients may have different aesthetic ideals and preferences, and based on their cultural background. The clinics should consider factors such as beauty standards, body ideals, cultural perceptions, cosmetic surgery in the targeted country. Adapting marketing strategies and procedures is very important in relation to the cultural sensitivities and preferences of the target market, and this can help clinics to establish connection and potential patients. The accessibility of a place, airport, transfers, etc. Consideration should be given to factors such as travel time, ease of visa processes. We had this problem with many countries, the problem with visas. People who had nearly booked a procedure, and they could not come because of the visa, and the availability of the transportation options. The countries which have good connectivity, well-developed transportation infrastructure, and convenient travel options, low prices of air tickets, can make it easier for patients to travel for cosmetic procedures. Reputation and branding is very important. The reputation and branding of a country in the field of cosmetic surgery can also impact patient preferences. Countries with positive reputation of cosmetic surgery and the history of successful outcomes as well may be more appealing to the patients. The clinics should consider the overall perception, not only of their clinic, of the overall of the country, in terms of its expertise, quality of care, and patient satisfaction when they are targeting customers. The language and communication. Effective communication is crucial. As it involves detailed consultations, how you will consult somebody and make me feel comfortable with you, if you don't speak well, if you cannot communicate with him freely. And the pre and post-operative instructions. So the clinics should consider the language and communication barriers that may exist in their targeted country. Apart from this, the clinics have to be able to effectively communicate with the patients to their native language, or to provide translation services of a high level. In this way, they improve the patient experience, and they build trust as well. Let's see, I will talk to you about 10 countries which are showing an increased demand for cosmetic surgery abroad. One is China. China has a growing demand of cosmetic surgery, particularly among the middle and upper class, because there is an upper class which is growing, and it's huge. As a percentage may not be very big, but as a number is huge. It's the same like India, for example. They have preferences in procedures like rhinoplasty, eyelid surgery, and breast augmentation. Russia is a bit problematic during the last period, but generally speaking, it has a significant demand of cosmetic surgery in any procedure, face or body, include mainly liposuction, breast augmentation, facelifts. We have seen from Russia many non-natural looking results which have to be considered.
Αν μπορείτε, Δόκτωρο Χριστόπουλε, λίγο πιο σύντομα, γιατί έχουμε περάσει το χρόνο.
Please make it short.
I'm going.
This is a very interesting presentation.
Yeah, Saudi Arabia, Kuwait, Qatar, Brazil is well known for cosmetic procedures, especially regarding body. Nigeria, we have seen an increase of demand from Nigeria, especially for procedures regarding the body. South Korea, especially for procedures regarding face. South Korea is importing medical tourists, but exporting as well. And Japan, about the same. Mexico is importing and exporting as well. The medical tourism is very active in both senses there. Colombia, Thailand is well known, a very well known destination, medical tourism destination. India, I have been working a lot with India, and I think I know this market. India has an upper class, very wealthy economically, who do not want to get operated in India. They just don't want to get operated, and they are disposed to go to other countries nearby, like Dubai, for example, where they will pay 10 times more the price of India in order to be operated out of India. In the same time, India is acting as a medical tourism destination as well for people from European countries or other countries of the area who want to pay less, to something at low prices. Australia has a big demand as well. United Arab Emirates, particularly in Dubai, is a popular destination for cosmetic surgery, and there we do nearly everything. And what I want to tell you as quickly as possible is that, for example, it's an example of two different strategies that we do. One strategy is what we do in Athens, where we are trying to attract people who want a very high level of services at a price which is not the lowest price that they can find in the world. I mean, but is value for money. They want a high level of service at an affordable price. And this is what they tell us when they come here. They tell us, people from the United States, for example, they tell us, the doctor, if you was in the United States, you could charge 4 times, 5 times more, and you would be one of the best probably there. And here we are lucky that we can come and pay much less. We don't pay as much as, we could pay even less in other countries, but we prefer, is value for money. In the opposite, in Dubai, for example, we attract very economically wealthy people who, as I told you, in their countries, they could pay 10 times less of what they pay there, but what they want is a very high level of, they want high standards, very high level of services, and they don't mind how much they are going to pay for this. And in conclusion, selecting the right country to attract customers for Cosmetic Surgery Clinic is something that requires careful consideration and multiple factors. So we have to consider the marketing demand, regulatory environment, healthcare infrastructure, affordability, cultural considerations, accessibility, reputation and branding, and all these. So thank you for your attention. Thanks for everything.
Ευχαριστούμε πάρα πολύ τον Dr. Christopoulos για την πολύ
Thank you very much, Dr. Christopoulos, for this very interesting presentation.
since we have many plastic surgeons watching us, can you share with us, from your experience, the three most popular cosmetic surgery procedures people come to Greece for? Well, we need to discriminate or separate those who visit Greece in two categories. Those who would come anyway, that is, people who were aiming at visiting Greece for holidays, or people from the Greek diaspora, or foreigners who like Greece and would visit anyway, and this different category, separate category, who come because of us and who opt to also enjoy their holidays in Greece. In the first category, we might have people coming in for whatever comes to mind, for small interventions, injectables, fillers, etc. The second category of patients are those who will come because of us and will extend their stay to combine it with holidays and vacations. They will be coming in for something that would be like a major surgery. So of course it's not just about the cost and the price, but what is most important is that we are trusted by them. We have had patients who were quite wealthy, and they came to us thanks to word of mouth. The cost was not an incentive. There is also another category of operations and procedures that are difficult to find in their own countries. I have published certain articles vis-a-vis the procedures regarding the pollen syndrome. There have been patients who have come to me because they have read my papers and they weren't able to find such treatment in their own country, even in the US. For instance, I'm expecting to see a patient who has done his own research in the US, and he told me that he's coming because of me. So we have people coming in for major surgery, breast surgery, liposuction, etc., or hair transplant, or people who want to have specialized procedures, face contouring, etc. People who might come in for major surgery, where there could be a significant difference in cost, or people who believe that they can enjoy better quality of services compared to the services provided in the country. Excellent. I'd like to thank all speakers for their presentations and for the answers to our questions. So this will be the end of this session. Thank you once again.